Our conversation with Vince Mercuri from The Open Door is brought to you by Marcus and Mack, a law firm representing injured people. And so I have introduced him already. He's Vince Mercuri, director of The Open Door in Indiana County. And Vince, people want to know, how are people reacting to the coronavirus and to COVID-19? It goes across all sectors of society. We ask business people. We ask folks in the health industry. We ask folks like you. For The Open Door, what's it been like over the course of the last 2 months?
Well, good morning, Indiana County. It's been, like everybody else, we've been adjusting to some unparalleled, unpredictable times. But really, one of the things we had done is our management team in the middle of February started plotting a course for what we expected was going to be, the potential for the COVID shutdown that could happen. I don't know that we predicted that it would be quite as intense as it's become, but we started planning in the middle of February to have a plan in place so that our drug and alcohol services particularly could do telehealth services for our clients, and that our crisis services would be able to function and go unimpeded as well. So as, with that planning, as February turned into the middle of March, we began to implement our plan and started to train our staff doing telehealth from home. I mean, the provisions for billing, the provisions for criteria, none of that was in place at a state level, but they did waivers on all of that so that agencies like mine and the Guidance Center could do telehealth from home, even if we didn't meet all the criteria that was originally and previously established. Mm-hmm. So we began.
Uh-oh, you still there? Uh-oh, Vince. Calling Vince.
On site.
There you go. Vince, you dropped off there for a second, so okay. Sort of go back to that thought.
Okay. Well, so we were, as middle of March turned into the beginning of April, we had people in place by that first week of April 8th actually, which was a Wednesday. We kind of flicked the switch and we started to have all of our therapists, after we had piloted it for a couple weeks, doing telehealth from home. And then we had our crisis services beginning to work out of their homes so that crisis would still be dispatched to meet consumers who were in crisis, not in their homes if we could avoid it. We tried to do it on their front porch, in the parking lot. I mean, it was less than ideal, but those were also standards of care that other crisis programs were doing across the state. So that by, early April, we had a full-blown plan in place and had implemented it, that telehealth was being done for all of our consumers. Crisis was available for all of the potential people that needed crisis. Now, for our Suboxone clients, those would be individuals with opiate use disorders, heroin and fentanyl and so forth. They still receive, even to this day, on-site services. On Mondays and Thursdays, they see our nurse navigator, Tina Hooker, and they see our medical director, Dr. Woodle. They see them in person for a history, for a physical, for medication monitoring. I mean, some things you can't just do by phone,
Yeah.
Now, again, there's leeway there. If somebody can't come in, they would at least see them on phone, and we have a plan in place that we would fax their prescription to the pharmacy, and they could go to the pharmacy or have it delivered to pick up the medications that they need. Mm-hmm. So all of the services, particularly the opiate services, which, there's high overdose potential and withdrawal, none of those services have been curtailed. They have continued. Continuing them in this climate has certainly been a challenge. Our overall clientele load is down because people just aren't tuned into getting the help right now or whatever. So we are concerned about that long term, obviously, for the health of the community. But we are, now that the designation to yellow has been put in place, we are working on, I just came out of a meeting and I have another one at 11 o'clock, to put a plan in place so that next week we begin to ramp up and have a little bit of a hybrid, as I will call it, for our clients, that they can do telehealth if they can't get in. Maybe a staff member has a legitimate medical issue or a family medical issue that they really can't take the risk to come in yet, then they could still work from home from a telehealth standpoint. And then also we will have more clinical staff on site to see patients who want to come in. We have clients who want to come in. They're calling saying, "Can I please come in and see my therapist? I don't want to do it over the phone anymore." So we're trying to accommodate all those different variables.
One of the things you said a couple of moments ago, harken back to a conversation I had with Dr. Dan Clark last week at IRMC, talking about surgery and about people putting things off, and doctors, because it's been so quiet in the ER and across the hospital as they prepare for what would maybe be an influx of patients having to do with COVID-19 that just didn't work out that way, that they're concerned that people who put off care end up with more serious problems because they really needed to be getting the care. And I know that has to be a concerning thing for you, too.
Well, that is definitely a concerning for us because, you know what, for somebody to take the step to get help, whether it's for alcohol and drug usage or the crisis line, it's a big step to call people to come in to, there's a lot of resistance. There's a lot of stigma to getting that help. And so once they take that step and they stay on that pathway, that's a healthy thing. Now that we've had this little diversion where people are off that pathway, it is definitely going to be a challenge to get people back on, and to see. I know I've talked to Jerry Overman now. That was, a little while back now, a month plus, asking him, had he seen any influx in overdoses, and he hadn't at that time, and I haven't heard that we have locally at all. But there is that concern that the longer people are away from, treatment, the harder it's going to be to get them re-engaged. Mm-hmm. It's one of the reasons that I'm calling our plan for next week and moving forward our re-engagement plan. We need to re-engage our clients. We need to re-engage the community, and I need to re-engage some of my staff, who are working hard from home.
Yeah.
But it's time to get folks back, on site again without any type of medical risk.
So take that opportunity right now and speak to that person out there who either began and then pulled away from it a little bit, or has been thinking about it and has been reluctant to get the treatment that they need. What do you say to them in order to get them the help that they really do need?
That's a really good question, Todd. What I would say to them is that the course of addiction and the course of mental health issues never gets better without some type of intervention to get help. We can make those false promises. We can break those false promises with the loved ones in our lives. But crisis and situations that we are in right now that are so unpredictable do not tend to lend themselves to stability or consistency. They tend to make us more unstable and more unpredictable. So if we were off course, if you were off course already, you're going to get more off course if you don't get the help that you need. And then, just like that person who's delaying maybe, a heart catheterization, the longer you delay, the more clogged that it's going to be. Mm-hmm. So earlier intervention, earlier treatment, sooner treatment is obviously going to make it for a better path to sobriety and a better path to mental health stability. The more we delay those things, they never get better. They always get worse. And that's not an opinion. That's pretty much a fact, medically and psychiatrically, that those issues are always going to progress and get more dysfunctional. Stress, strain, uncertainty never makes those things better. It always makes them worse. So, give whoever, if it's the Open Door, give them that call at 724-465-2605 if it's for drug and alcohol. If it's for crisis, 877-333-2470. Those are the lifelines. Mm-hmm. If it's the Community Guidance Center, reach out to them and get the help that you need.
2 months into the whole new world in which we find ourselves, and we think about, is it what we thought it would be? So think back those 2 months. Is what the Open Door has experienced in the past 8 weeks what you thought going into it would be the experience that you would have?
I knew that my team would rally. I knew that my staff would step to the plate and get the training for the telehealth and provide the services for the general public that we provide. I'm not sure that I would have predicted the level of uncertainty and the level of fear that is out there right now with the general public. I would say that I would have underestimated that. I thought that we would be needing to take some precautions. I'm not sure that I would have ever imagined that my mother, who's in a nursing home, I would not be able to see on Mother's Day at the age of 92. So I think the intensity and the veracity of the government directives has been a little more intense than I would have ever expected. Because when all is said and done, and certainly we need to continue to follow all of the CDC guidelines as they've been recommended, the need for the hospital beds wasn't as great, thank God, and the need for the respirators was not as severe. Again, thank God for that. Mm-hmm. So I think that the intensity of the fear, and fear is never good medicine. Fear is never good medicine. Fear always makes people think and react and do things that we would not normally do. And so I am more concerned about the level of fear that this has placed in people's lives and the isolation that is occurring because of that fear than I am anything.
Just a minute left here with Vince Mercuri from the Open Door. Pretty satisfied? Is the state doing a good job of being clear about what you can and cannot do at the Open Door? Are you getting good guidance?
Yes. I mean, we've always been an essential service from day one. And, that was more complicated than people might think. When you're still working and expected to function when everybody else is shutting down, has its own level of uncertainty. And I've always been very concerned about my staff and our clients' health. So we started screening people, like May 14th, May 15th, March 14th or 15th, very, very early on. Actually, it was March 18th. So we started screening people pretty early, but the state's been pretty clear that they want drug and alcohol services to continue to be offered, but they want them to be continued to be offered in a safe way that protects not only our clients, but especially the general public and our staff. So, yes, the state's been pretty clear. They've been very helpful. Our SCA, Cammie Anderson and her crew, have been very supportive. They've offered some support and some safety net down the road financially if, we continue to have less revenue than we had budgeted and so forth. So we've gotten a lot of support. My board's been very supportive, even though we haven't been able to meet in person. But my board president, Sheriff Fyock's been supportive. So the staff's been great. My administrative team's been good. My frontline workers, they are without a doubt unsung heroes. Everybody always says the hospital employees, and I appreciate that. Nobody says the drug and alcohol counselors or the crisis line workers.
Sure.
But my frontline staff has been unbelievable in their commitment to stepping up to fill the need for the public.
It's terrific stuff. Vince Mercuri, the Open Door, thanks for spending some time with us today.
Oh, it's always a pleasure, Todd. Thank you very much.
Check in again. Okay, have a great one.
Bye-bye. Bye-bye.